flush like that. Okay, Jason's going to explain the unit and then I'll go.
We've got our clinic set up here in Case of Buco, Bolivia, and this is pretty much standard that we've done this for several years. We have 2 chairs set up. This one was already in Case of Buco, and so was the other chair. I'm going to primarily be doing operative and fillings, and Dr. Jenkins is going to do extractions, and that kind of makes everything smoother. Now, every once in a while, if we have a lot more extractions than we need fillings, then we'll both do extractions. But basically, for the setup, we have the chair and we have a light, a gooseneck light here, and I'll have a headlight too that I'll use. And this gets them in a pretty good position. We have the portable demo units already set up. The suction pumps are all ready. There's clean water in the water bottle. All my hand pieces are set up. My slow speed suction, my high speed suction hooks on to the back. This whole instrument tray is in this gray box, or the gray bag that's always in there too. And so you just take it out of there, and the handle you use to carry it through to roll it through the airport turns into your instrument handle. And I usually have it elevated off the floor so I can switch the switches without having to bend over already. But basically, you just turn the air compressor on. It's ready to go. Toggle switches. The first one switches from high speed to low speed hand pieces. Got my high speed, my low speed. The second one's whether I want water to come out of my high speed or not. And then these others are to control the air, the speed of your high speed and low speed. There's a foot pedal attachment. The only reason I don't use it is usually when you have the foot pedal depressed, the unit turns on. But I like to run the suction all the time because you don't know when you need it. So I will use the handpiece control to turn my handpiece on and off as I need to. And then I have all my operative set up to do composites, and we just have all our instruments out here. I'm going to let Dr. Jenkins kind of walk you through our non-sterile to sterile and our setup.
Well, it'd be really better if we had a larger table that would give you a little bit more room, because we're slightly crowded this time. But what you like is 3 bins for your cold sterilization. These actually came from Walmart. The first is we'll have soapy water for scrubbing, and you need a scrub brush. This is a make-do scrub brush. I would recommend you bring 3 or 4 scrub brushes from the OR at the hospital. The next bin actually has your cold sterilization solution, and we've been using Setup, and it has a mixture of 2, and we change it about every 2 days or so. The third is plain water for rinsing, and we'll let it and we let it sit in the cold sterilization solution, hopefully for 20 or 30 minutes. Sometimes you are rushed and we're not able to do that, but that would be ideal. Then, of course, the rinsing solution, which it really just cleans it. And here's set up with which we share between us with the syringes, and then all the faucets, and try to keep the faucets in order of anterior, posterior, lower and upper. Elevators, try to keep our syringe setups close so we can make up our syringes. And as you can see, the gloves, and a unit here for basically suction, for surgical suction. It's a good idea if you have a couple of units, each have a trash can on the walls, and have a bottle to put your Sharpies in. that's, basically, I hope we have it covered. If you have any questions, just give us a call or contact Keith. We'll be happy to answer. Have a good